This multivitamin mineral product is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. It provides a variety of vitamins and minerals to support overall health and well-being in kids. The daily dosage for kids is determined by their age and nutritional needs. It is best to take this medication with a meal to help with absorption. Make sure to chew the kids' multivitamin minerals thoroughly and swallow it, typically once a day as directed. It's important to follow the directions on the product package or as instructed by your doctor. Avoid taking more than the recommended dosage. If you have any questions, consult your doctor or pharmacist. Taking this medication regularly will help you get the most benefit from it. To help you remember, try taking it at the same time each day. This will help ensure that your child gets the full benefits of the multivitamin minerals. If your child experiences constipation, diarrhea, or an upset stomach after taking this medication, these effects are usually temporary and may go away as their body gets used to the medication. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects. Many people who use this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. If the multivitamin you give your child contains iron, make sure to keep it out of reach to prevent accidental overdose. Iron overdose is a leading cause of fatal poisoning in children under 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. Before giving this multivitamin mineral to your child, it's important to talk to your doctor or pharmacist if your child has any allergies to the ingredients. This product may also contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your pharmacist. It's also important to let your doctor or pharmacist know about your child's medical history, especially if your child has a history of alcohol use, liver problems, or stomach/intestinal problems. If the multivitamin also contains folic acid, it's important to inform your doctor or pharmacist if your child has a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which can result in serious nerve problems. If the multivitamin contains aspartame, it's important to consult your doctor or pharmacist if your child has phenylketonuria, PKU, or any other condition that requires restricting intake of aspartame. Before your child undergoes surgery, it's important to inform the doctor or dentist about all the products your child is using, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant or breastfeeding, it's important to consult the doctor before using this medication. It's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If the multivitamin mineral product your child is taking contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If the multivitamin mineral product also contains folic acid, be sure to tell your doctor or pharmacist if your child takes certain anti-seizure drugs. This medication may interfere with certain lab tests, possibly causing false results, so it's important to make sure lab personnel and all your doctors know that your child is taking this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. When it comes to kids' multivitamin minerals, it's important to know that these supplements can help support a child's overall health and well-being. They can provide essential vitamins and minerals that may be lacking in their diets, helping to fill in any nutritional gaps. The daily recommended dosage will vary depending on the specific product, so always be sure to check the label for the correct amount for your child's age. It's generally best to take kids' multivitamin minerals with a meal to help with absorption. Remember, it's always a good idea to consult with a healthcare professional before starting any new supplement routine for your child. Make sure to keep up with all of your medical appointments and any recommended lab tests. It's important to note that kids' multivitamin minerals are not a replacement for a healthy diet. It's always best to get essential vitamins and minerals from a well-balanced diet. Make sure to follow any dietary guidelines provided by your child's doctor. If your child is taking this multivitamin mineral on a prescribed schedule and forgets to take a dose, give it to them as soon as you remember. If it is close to the time of the next dose, then it's okay to skip the missed dose. Just make sure to give them the next dose at the regular time. Do not give them double the dose to make up for the missed one. When storing kids' multivitamin minerals, make sure to keep them at room temperature and away from light and moisture. It's important not to store them in the bathroom and to keep them out of reach of children and pets. When it comes to getting rid of any leftover or expired medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product by consulting with your pharmacist or local waste disposal company. This is important for the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.